Hi, I'm Dr. Jim Edwards with the Bedford Chiropractic Center. Today we're going to talk about the spinal subluxation complex, or what we just always on a day-to-day basis call a spinal subluxation. What I have here is a model of two vertebrae and the disc in between, and then we can see where the nerve is exiting out of the nerve opening. We have one of the small spinal muscles demonstrated here, and if I turn it this way, you can see that the spinal cord runs in the center, and then the individual spinal nerves come out through those openings, and then the nerves divide, and there's a motor side and a sensory side, meaning that those messages either send motor messages telling your muscles and your organs to move and do things, and the sensory part is where kind of the feedback comes back in from the body. It goes into the spinal cord and then up to the brain so that the brain can process it. And it's that constant interaction of information out and information in that keeps our body healthy. Problems occur at the spine whenever the spinal joints become either misaligned or lose their ability to move. So I'll use this to demonstrate first, and then I have a couple of other little visual aids that help us to demonstrate that. But if we look closely, if we bend, we can see that the spine bends from side to side. And if you look closer at the muscle, you can see when we bend this direction, these spinal muscles become stretched and these spinal muscles contract. And if we go the opposite direction, the opposite happens. Now these spinal muscles have to stretch while these spinal muscles contract. So that's side to side motion. If we turn and look at you from the side, and if we go forwards and backwards, if you notice here and here, you can kind of see the movement. As we bend forward, these are called spinous processes. They bend or they move apart so that we can bend forward. And again, the muscles have to stretch. When we bend backwards, the muscles contract, as we see here. And we also can see that when we bend, the disc moves. So the disc has to be flexible as well. And this is what's called a motion or a movement segment of the spine. So, as I said, problems occur whenever we lose the ability of those joints to move. So again, I have a visual demonstration here. We pretend or imagine that these are the vertebrae, and when we bend from side to side, each of those joints should be able to move left and right, forwards and backwards, and then also each joint has to be able to rotate from side to side. So there's 6 motions, 6 movements that should occur between every vertebra. Problems occur, as I said, whenever an area of the spine, like these 3 red ones, lose the ability to move. They kind of lock together, and it can be either the joint itself that becomes frozen or locked, or it can become the muscles around the joint that support the spine that become spasmed so much that they no longer allow that portion of the spine to move. And because the nerves exit between every pair of vertebrae, if the joint doesn't move properly, it causes a malfunction or lack of function in the spinal nerves. And then the last thing I use to demonstrate, because I like to use visual aids, I use this to demonstrate to patients what is happening with their spine. So if you come in and you're in pain, you can kind of imagine that your spine and your spinal joints might look more like this rusted end of the bolt where things just don't move. It's frozen up. There might even be some arthritis that's starting to develop. So this is a good visual aid of kind of what the problems are with the spine. And then I say our goal is to take you from being here and move you toward this direction, where the joint moves freely and smoothly and you get complete motion, and then we restore the normal health and the regulation of the nervous system. So that's just a brief demonstration of what a subluxation is and what we do as chiropractors to identify those and then do the appropriate treatment to correct. So hope this has been helpful, and we'll talk to you soon.